You're watching Central Illinois Newsday.
Fall can be a wonderful time of the year for most people living in our area, but those that have asthma, it can be difficult. Thanks for joining us on Central Illinois Newsday. I'm Paul Zakovic. Joining us now is Dr. Penelope Ewbank with Springfield Clinic. Dr. Ewbank, thanks for joining us.
My pleasure.
Now, what are some of the common asthma triggers that we see during the fall?
Well, in the fall, there are a variety of things. You've got the temperature or weather change, and cooler, drier air often kicks up some people's asthma symptoms. You have fall sports like football and volleyball and some basketball rolling in, and some people's asthma is worsened with exertion. And then finally, allergies. Pollens like ragweed and molds are at higher levels in the fall. And oftentimes people think of allergies causing the typical hay fever symptoms like stuffy, runny nose and watery eyes, but allergies also cause asthma.
And what are
you've got lots of things coming at you in the fall.
What are some of the symptoms that we're going to see?
So for asthma, you can get shortness of breath, wheezing, chest tightness, and even a cough. And people often forget that a chronic cough can be due to asthma. Not everybody who has asthma wheezes.
How can cope cope with asthma during the fall?
Well, fortunately, we have lots of treatment options. You can try to avoid triggers, but of course, for pollens and outdoor weather, you can't really avoid that. You have to go outside and live your life, right? We also have very good medicines that can control the inflammation in the airways. And we have some non-medication treatment options as well. Our goal is for patients' asthma to be very well controlled so they don't have any limitations regardless of the season.
Are there certain things that you can take that are over the counter?
Well, there is one over-the-counter inhaler that purports to treat asthma. And I have qualms about that one because it has more side effects than the prescription rescue inhalers. Additionally, if a patient requires a rescue inhaler, that's one that relieves sudden symptoms. If that is needed more than once or twice a week on a routine basis, that suggests that patient should be on a preventative maintenance medication. So it concerns me if a patient were to just grab an over-the-counter inhaler and use it a lot, because that's just treating the symptoms, but not the underlying problem.
Now, are there treatment options other than medication?
Absolutely. I alluded to environmental controls, which frankly are often difficult. But beyond the excellent medicines that are available, from the allergy side, we can identify allergy triggers with skin testing. And then this can enable us to place patients on immunotherapy, which is the fancy word for making extracts out of the natural things that patients are allergic to. And they're injected in small increasing amounts over time. And this slowly causes the body to kind of ignore the stuff in the environment instead of having this inflammatory reaction. So in the long run, that's the best chance to feel better and need less medicine. It prevents the inflammation in the first place rather than needing more and more medicine to suppress the inflammation. Additionally, allergy shots make it far less likely for people to become allergic to more and more things over time. And they also cut in half the progression of rhinitis to the development of asthma in the first place. So it's truly a disease-modifying treatment. And in fact, the newer asthma guidelines recommend that even patients with mild persistent asthma should be considered for an allergy evaluation and potential allergy injections.
When should patients see a doctor?
Well, I think that anybody who has chest symptoms, has asthma symptoms, really should be evaluated. You know, breathing is modestly important, as we all know. And it concerns me that people often get used to living at a lower level. People might think, oh, I just have a little symptoms when I run. So they pull back, they become less active. Kids aren't involved in as many activities, or people just get used to having symptoms and think that's normal. So it's best to have that evaluated, even with objective measures, with lung function tests, because some patients think they only have exercise-induced asthma, but they have persistent asthma that's there all the time. They're just more aware of symptoms when they try to become more active. So anybody with breathing issues should really be evaluated by a physician. And naturally, I'm biased and think that a specialist is indicated for patients for at least one visit if they have persistent asthma.
And just to keep someone at ease, what can someone expect when they are seen for the first time for asthma?
Well, obviously, we'll take a very good history to identify symptoms, to drill down on potential triggers, because there are exacerbating factors beyond allergens like nasal disease, sinus disease, acid reflux. So we take a very detailed history, the usual physical exam like any doctor's appointments. We have some breathing tests that are done, which is just a matter of blowing into a machine hooked to a computer. So that's easy enough for us to follow lung function that way. And sometimes we'll do allergy testing, and they're just specialized plastic toothpicks with little scratches on the surface of the skin. And then we have those results in 15 minutes. And that can be used to guide treatment options.
Dr.
And then we
Ewbank.
spend a lot of time on education as well for both trigger avoidance and proper use of medications and inhaler technique.
Excellent. Well, thank you for your time today, and thanks for the great information, and thanks for joining us.
It's my pleasure.
All right. Thank you. For this interview and more information, visit our website, ciproud.com. Central Illinois Newsday will be right back after this.